kind of begin with a quick reaction to seeing the first healthcare worker here in the county get the vaccine?
Absolutely, it's a historic moment, I believe, in Fort Bend County, and we started this journey 10 months ago, and today there is hope, and I'm very excited, and I'm here to witness that. And so I'm so thankful we have at least a small number of vaccines available. We could vaccinate our clinical services staff and other frontline workers. And as I mentioned before, I'm not going to get in front of our people who are in the forefront, and so I'm watching and I'm here to support and also tell our citizens, the hope is on the way. I mean, the vaccines are also on the way, and right now we only have a small sample of it, but every day we will be getting more and more vaccine, and so, but don't let your guard down. That's my message always, because the COVID numbers are extremely high. We are under a red alert. That means the highest level, and and also I will tell you this. If you look at maybe 6 to 8 weeks ago, it was maybe 6-7 weeks ago, our COVID numbers were like 22,000 positive cases. Today it is 32 plus. And also at that time, the active cases were like around 1,000 or even less. Today it is around close to 9,000 cases, active cases. So don't go to, big gatherings, because actually our Dr. Minter, HHS director, said it rightly, because if you go to a large gathering, there is somebody there with COVID, and it is almost guaranteed the way things are. So stay away from that, wear your mask, and all the basic CDC guideline, follow this. It is not for long. We are going to get more supplies, and we are going to be announcing on a daily basis. And we already started a website, fbchealth.org, but it is we stopped taking registration because we only have 1,000 vials, but we already have 5,000 application. So we don't want people to get frustrated about it, because I heard in Houston they have 750 vaccine, 145,000 people or something signed up. So it's very frustrating. So that's why we closed it temporarily. But as and when more of vaccine available, we will open it up, and stay tuned and get the information from our HHS website or even social media, and come back and register if you are not registered. We are here to help. One promise to Fort Bend County residents: we are going to do everything possible to bring maximum number of vaccine to our county, and we are working with the state health authority and also CDC, everybody, so that we could continue to bring more vaccine. That's the only way we can. We need to get more people vaccinated. That's the only way we can accomplish that herd immunity. And so we are progressing that direction, and I'm glad we at least have 1,000 to start with, and you will be hearing more. And we will announce as and when we have more available, and also those who are registered. You will be hearing phone call from Fort Bend County HHS department with a time and place where you need to go and get the vaccine, and it is free, and we are paying for it. And I just want everybody to go and get vaccinated. That's the goal.
So you have 1,000 today, and when do you expect more? Any time limit?
See, last Friday I was on a conference call with the state health authorities. Even they don't know. That's the problem. Because, I don't know, you remember in March and April, the problem we had with the testing kits. That's the phase we are in. And we will prevail, and we will get out of this phase. And honestly, to be honest with you, I don't know. And so this is supposed to be here by, I think, Sunday. Now we got it. So it's happening, but my message to our citizens are be patient. We are doing everything possible to bring it to you, so that we all could get back to somewhat normal life sooner than later.
You talked about how you opened up this website where people could register and you received that.
Now it is closed because we only have 1,000 vaccine and we already passed 5,000 registration already. And so we will open it back when we have more vaccines started coming.
So due to the demand, how do you guys plan to kind of process and how will you prioritize? Is it first come, first serve?
This is actually, obviously, as you know, it's based on need. This phase is based on need, and people who got the compromised immune system, and also people who are above 65 years of age. And Fort Bend County HH Health and Human Services is 100% prepared. And this morning I had a conference call with our HHS director. She said, if they send us 25,000, we could manage it. We have 4+ freezers already ready. We accumulated all these very expensive freezers in 4 places. And so many preparations are done behind the scenes. So if they send it 25,000 today, we are ready to administer that. And so we did all the background work. Now we are waiting. It's a waiting game, and we will be getting more vaccine.
Which actual vaccine did you get?
This is the Pfizer one.
The Pfizer.
Yeah. And that's my understanding.
I thought such thing as
These 5,000 people that are already registered, how soon can they start getting their vaccines?
Like I said, I like to do it. I like to give it to them yesterday.
Out of the 1,000 you have, when will those start?
This is actually the first. We have to get vaccinate our staff. Our staff means part of the clinical services. That's what we just started. And as soon as this phase is over, like maybe 1 day, 2 day, and it will because see there is a lot of uncertainty attached to all this stuff, and that's a good question. But at the moment, I don't know. It could be tomorrow. It could be as early as tomorrow. There is no point in holding on to vaccine in our hand. We wanted to get it out ASAP.
How many do you need for your employees out of those 1,000?
I have to ask that question. All employees are not. Only the clinical health services employees are the one getting. Personally, I choose to stay back and stand in line because I don't want to get in front of our, medical workers and also our older people. And so I really don't know that number. I don't want to say something I don't know. But Rita, do you know how many vaccine we need for our staff and how many we will be approximately? We don't know exact numbers. So we will be giving out to our citizens.
You know what, let me go get,
Dr. Minter?
no, not Dr. Minter, Barbara can actually answer those questions.
Okay.
Very well.
Yeah.
So she can come back and answer some questions for you.
Yeah, please.
good.
Yeah, because what happened is I don't want to say something which is not accurate, which is I don't know. And, so this is one thing I learned last 10 months. It's a moving target, like it is always moving. And so I don't want to give you some information which I don't know 100%. So Barbara is going to be answering that. Yes.
How difficult will it be to, like you just said, it's a moving target. How are you going to try and keep the public aware of what's going on? Because it seems like you said, it's a moving target. You don't know how many shipments are coming in, and you got to keep the public aware to say, okay, where do you need to? This is where you need to go. This is when you need to be there to receive the vaccine.
And Chad, you know that if we are good at anything, communicating with our public, and we do every single day. And I encourage them to be part of our social media. One thing, if you don't have access to social media, make sure they can, or somebody they know can visit our Fort Bend County HHS Department's website. Mm-hmm. And also FBC Health is where you register, but that is not just for registration. All the COVID-related information is there.
And that's what I'm asking. How, is there initial plans to try and get this vaccine out to people to put, to say, okay, this is where you need to go. If you're in Rosenberg, you go here.
And
if you're
so
in Katy, you go
that's
there.
a question for Barbara.
Okay.
So actually, Barbara's in observation. I don't know if you guys are aware, but when you're in observation.
Oh, you got it. Oh, okay,
yeah, so
okay.
we can't bring her out. And with respect to where do people go, so everybody who's been registered will be contacted.
Oh, yeah.
Okay.
Yeah, exactly. I'm sorry. Exactly. One of the reason you have seen in Florida and all people, sitting in line all night, and so we don't want that. And so that's the reason why we are asking people to register. And so what really happen is they will get contacted, as I mentioned in the beginning. They will get contacted, and also they will be informed when and where they need to go to get vaccine. And that's the reason why we have their information, and the HHS department will be reaching out to them.
Thank you.
Yeah. Thank